Namaskar. Everybody wants to have a healthy baby, perfect and beautiful. There are still some problems that the baby can have, and if your first baby and everybody in the family is healthy, still some babies may have some problems. One of them is Down syndrome or trisomy 21. So today I would like to share with you how prevention of a birth of a child with Down syndrome is possible and what you need to know about that. I am Dr. Shubha Phadke, a medical geneticist, professor and head at the Department of Medical Genetics in Sanjay Gandhi Postgraduate Institute of Medical Sciences at Lucknow. As I said, everybody, when somebody is pregnant, everybody knows that this is going to be a normal, healthy baby. But as I said, Down syndrome is one of the common genetic disorders seen in the babies born. So, for that, before you can understand what Down syndrome is, let us see what chromosomes are. Everybody's body of every living being, whether plant or animal or human beings, is made up of small bricks which are called cells. And in this each cell there are 46 chromosomes, 23 inherited from father and 23 from mother. And this contains all genetic material which gives a similarity with the parents. Out of these 46 chromosomes, the pair number 21, like every pair will have two pieces, and in case of Down syndrome, instead of having two copies of chromosome 21, there can be three copies, and this leads to various developmental differences or abnormalities in the baby, and then the child is called Down syndrome or trisomy 21. Out of 1,000 children born, one child has trisomy 21. It is the commonest cause of intellectual disability. So, if you see, there are 100 children with various types of intellectual disability or mental retardation, then about 30% of them have trisomy 21 or Down syndrome. And of course, there are other thousands and other different causes of intellectual disability other than trisomy 21. As I told previously, the child with Down syndrome can be born in any family, and there is no need that there should be a previous similarly affected child or somebody in the family. These children with Down syndrome, the major problem with is that their intelligence is low. That means their understanding is low and the IQ is usually around 50 to 60, and of course it's very variable. Somebody can have IQ of 70 or more and can perform much better in life. They, all of them mostly, can learn to walk, talk, take care of themselves, also can get some amount of education, and they are trainable, and some of them can do useful activities and simple jobs as an adult and lead a happy, healthy, and fruitful life as in semi-independent settings as an adult. To know what really it means, you can see various websites. Like this is a website of Down syndrome made by the society, by the parents, and you can see this girl with Down syndrome is talking how she is different from other children, and what is extra in her and as compared to other children. You can see many other children discussing their issues in the other picture. So these children with Down syndrome, though they are different, everybody has some interesting or important assets as well. And the severity of intellectual disability varies from different in different children. And as I said, they can love you, they love everybody, and you will love them. So they can lead happy, healthy, useful, loving life, because we have seen so many children with Down syndrome are stillborn, and their parents are trying to give them best type of life. So these are pictures from internet, various achievers with trisomy 21 leading important ways. Some have also featured in the movies, and they participate in Special Olympics. But in spite of that, I would like to tell that bringing up a child with some intellectual disability is a really challenge. And then this challenge, if many people would feel that if known beforehand, they may like to avoid birth of a child with trisomy 21 or Down syndrome. And that's what I'm going information today. So how can we prevent Down syndrome or a birth of a child with Down syndrome? We don't know what is the cause of why these babies have trisomy 21. Why does this extra chromosome come from? And then that's why there is no medicine which can be given to a pregnant woman to really guarantee that she does not have child with trisomy 21. Many of these conceptuses with trisomy 21 are spontaneously aborted before 4 months of pregnancy, but some of them survive, and many of them are, so as I told, 1 in 800 to 1,000 babies born have trisomy 21. So what can be done is that one can test the baby in the womb, maybe in early pregnancy or at least before 20 weeks, so that if there is the child in the womb, or the by prenatal diagnosis shows that the child in the mother's womb has trisomy 21, the family may decide to discontinue the pregnancy. So this point is very important. There is no curative treatment even if you identify and diagnose that the baby in the womb has trisomy 21. So basically it's giving you the family an opportunity by testing the babies in the womb and making them decision whether they would like to continue a pregnancy when the fetus has trisomy 21 or not. So some of them have some ultrasonographically detectable abnormalities, and they may be picked up because of that. But even if the ultrasound is normal, the child can have, or the fetus can have trisomy 21. So the best way to do is to put a small needle in the mother's womb by looking under ultrasound guidance without harming the baby and mother, and take the fluid and test it for trisomy 21. However, for 1,000 baby women, if you test, then there will be one with Down syndrome. And hence, it's not advisable to all women to undergo this test. And because though this test is very easy and usually doesn't lead to any problem, if you do amniocentesis or take the fluid by such a needle in the mother's womb, then the possibility that there will be spontaneous abortion following the procedure is 1 in 1,000. So not very risky, but better to be avoided unless it's very necessary. And hence there are simple tests on mother's blood which can give you idea or do screening and give information if the baby in the womb is high risk of having trisomy 21. So not definite, but if you get to identify the risk is more, maybe 1 in 350, 1 in 250, 1 in 100, then those mothers or those females can undergo the testing of amniotic fluid by putting the needle in the womb or amniocentesis. And then those will be confirmed. So after confirmation, one can decide whether to continue the pregnancy or terminate the pregnancy. And for these, the various tests, as I said, one test is around 12 to just before 14 weeks. This is a blood test associated with ultrasonography. And the other can be done around 15 to 19 weeks. And this is called quadruple test. So both of them can detect about 80 to 90% of babies with Down syndrome. The advantage of doing it in the first trimester or before 14 weeks is that you will get information little earlier. But as I said, Even many of those babies with trisomy 21 do get spontaneously aborted or removed, body removes them before 16 weeks. But the test of double marker test, which is done in the first trimester, also has some other use for testing for possibility of growth retardation in the baby. So if the pregnant lady comes during first trimester, better to and offer this first trimester double marker testing. The second test is quadruple test, can be done from 15 to 19 weeks. It can be done later, but the whole purpose is that we should get confirmatory results before 20 weeks, preferably. On termination of pregnancy, previously was allowed till 20 weeks, now it's allowed up to 24 weeks. So the advantage of this quadruple test is that, as I said, if there are some babies with the trisomy 21 get spontaneously eliminated before 16 weeks. And the second important thing is the quadruple test has one important test or marker, which is called AFP or alpha fetoprotein. It can detect various open neural tube defects, as you can see in the picture. And there is a defect in the spinal cord at the back. And these type of defects, they can be diagnosed or suspected by MSAFP, and these are very commoner than Down syndrome. They occur in 5 per 1,000 babies, and they can be ultrasonographically detected, but sometimes missed, and hence doing quadruple test and additional alpha fetoprotein for spinal these neural tube defects is a very useful thing. And secondly, once you take the sample for of the baby for Down syndrome, and as I said, many of them, only 3 to 4% will have Down syndrome. And if amniotic fluid shows that there is the fetus does not have Down syndrome, then the same sample can be used to look for many other causes of intellectual disability called as by cytogenetic microarray, and it can detect some more causes, and then probably it will take care of some other disorders as well. The other way, as I said, you can test everybody's fluid, but as I said, though it can detect all Down syndrome and many other genetic disorder, it is not, such invasive testing is not offered to everybody. The costs which are given here are approximate because they vary from laboratory to laboratory. And the last very important test I'm telling you is a test on the mother's blood, but it doesn't test any biochemical markers in the blood, but it tests the DNA of the fetus, which is floating in the mother's blood. And then it is much more accurate, almost 99.9% accurate for detection of trisomy 21. But it is very costly. And though it's a technological marvel, and we are really surprised that such type of test is available over last few years. But I would like to again say that it can test for only Down syndrome, and other disorders which it tests are very rare, and many other causes of intellectual disability cannot be detected by even this test called NIPS. So though it's very costly, it looks at only a small thing, that is trisomy 21. The only advantage is that it has little more detection rate than a double marker or quadruple test, but the possibility of requiring amniocentesis for confirmation is very less. And then those families who have previous abortions, or a pregnancy is very precious because it's a test tube baby or something, they may like to go for NIPS. But again, I have to tell you and remind you that in spite of being such a costly test, almost similar information is available by first trimester and second trimester double marker and quadruple tests. So the protocol, as what I would like to suggest, that if you are pregnant and if less than 14 weeks, so from the, preferably 13 weeks to 13 weeks, 5 days. Because by that time, the size of the fetus is so reasonably big enough to look at some details of the baby. And you can also look at if there is some major malformations, and then the double marker information. And as I said, non-invasive prenatal screening, NIPS, can be discussed with the family. If there are no cost constraint, then one may go for NIPS, but otherwise in routine pregnancies, such a costly test is not that necessary, because there are many other things which will also require some funds for that. So if these are tests, any of these tests is positive, even NIPS, it detects most of the 99% Down syndrome. But if it is positive, then confirmation by taking out fluid from the amniotic fluid cavity is essential before you can take irreversible decisions like termination of pregnancy. So if you do first trimester screening or NIPS, or you do a quadruple test at second trimester, that means 16 to 17 weeks, then after these tests are positive, one can go, if they will need to go for invasive testing or amniocentesis, and do chromosomal analysis on that for confirmation of trisomy 21, or if the report is normal, then it will rule out trisomy 21. So in addition to this, MSAFP will have to be done if its first trimester screening does not include MSAFP. So if first trimester screening is done, then the MSAFP to be done. And if you do second trimester screening by quadruple test, that includes MSAFP. And as I said, by that time, ultrasound also can detect many other abnormalities. So in addition, if you had, however, whether you do double marker test or not, one first trimester ultrasound around before 14 weeks is very important to see the growth of the baby, as well as if there are twins and some other issues. So again, to confirm that if the double marker test or NIPS is negative, then there is no need to go ahead for further testing by quadruple test or any other test. So, and the NIPS test, I would suggest that technically it is possible before 13 weeks. I would suggest not to do it because, as I said, many of the fetuses with chromosomal abnormalities are spontaneously aborted. So see if the fetus is doing well by 13 weeks, then only the further testing for Down syndrome by double marker, NIPS, or quadruple test should be done. So again, coming back to if any of these screening test is positive, the important to know that if the test is positive means it does not mean that the fetus has Down syndrome. It only means that the possibility that the fetus may have trisomy 21 or Down syndrome is in the higher range and just enough to go for further testing. It does not mean that you can terminate on the basis of positive screening test, or you need not panic, but please immediately report to the doctor, and then as per advice, further testing of the amniotic fluid need to be done for that particular fetus. So when amniotic fluid is tested for chromosome 21, not only 21, but will test for all other chromosomes, and microarray is another test which can detect some other causes of intellectual disability as well. So taking the fluid from amniotic fluid is a very simple test. Very minimal pain can be there sometimes, but usually it doesn't lead to any problems. And these are various ways to look at the chromosomes by karyotyping. But usually within first in 4 to 6 days, you can get a report just to say, check whether the chromosome 21, 13, and 18 are normal or not. And for these are the rapid tests which are called QA-PCR and FISH, or fluorescence in situ hybridization. Other rest of the fetus does not have trisomy 21, then one can go ahead with further testing and look for other things as well on the same amniotic fluid sample. But if the The fish or qPCR also shows that the fetus has 3 copies of chromosome 21, then one may decide, consider termination as per the family's wishes. So, one more thing, I still want to again talk about non-invasive prenatal screening because it's very costly and it's effective, but it's not cost effective. And so, in the pregnancy, there are many things which required consideration. And for a disorder, which can be the possibilities 1 in 800 or 1 in 1,000, how much money should be spent on screening for such disorder, it will be a matter of debate. So those who do not have any cost constraint, they may go ahead with this testing. But for other individuals or other families, I would like to tell that quadruple test has a good screening if efficacy, and quadruple test followed by amniocentesis, if it is positive, will detect more number of children with intellectual disability than NIPS, though it may miss occasional cases with trisomy 21. So again, I would suggest that quadruple test and good ultrasonography. So one ultrasound at around 13, 14 weeks, and then quadruple test at 16 weeks, and ultrasonography, and if required, amniocentesis around 17, 18 weeks. So by 20 weeks, one should know whether the fetus has Down syndrome or not. So then, if these are taken care of, then repeated testing for again and again, repeat quadruple test, repeat NIPS one after other, they are not required. And and once we know that the screening test is negative, it does not mean that the fetus does not have Down syndrome, but it means that the possibility that the fetus has a possibility that Down syndrome is so low that further testing and further attention in this matter is not required. So rarely a child with Down syndrome may be born even if the quadruple test is low risk, even if the double marker test is low risk, even if NIPS is low risk, and sometimes even in spite of all these doing, the Down syndrome child may be born, but that is a small possibility. One will always be there. Also, even if ultrasound is normal, still it doesn't rule out Down syndrome. So this is only not to frighten, but just to tell that there is no way which can test the fetus in the womb for Down syndrome and guarantee that the fetus will not have Down syndrome or any other cause of intellectual disability or any other genetic disorder. So some background risk always will be there. Then the NIPS also offers testing for X and Y chromosomes, and then it offers some abnormalities like small deletion on chromosome 22. Then it also offers screening for all chromosomes from 1 to 22. So I would say all these are not indicated at all, because those children with such type of chromosomal abnormalities of X or Y chromosome, they are intellectually normal. They may have some reproductive issues, but now in the era of test tube babies, all these individuals with reproductive problems have solution. And secondly, there are some sex chromosomal abnormalities like triple X or XYY. They are absolutely normal and they do not have any intellectual disability or not even reproductive problems. There are many such individuals in our society which go unrecognized throughout their life. So, to summarize, what one family needs to know before deciding whether they would like to go ahead for screening for Down syndrome or not are the few things. Down syndrome is one of the causes of intellectual disability. There are many other causes of intellectual disability which these screening tests cannot identify. The children with Down syndrome they can talk, walk, and are trainable, and they can lead happy, loving life in the family. The chance is 1 in 1,000, not very, very high. It's only 1 in 1,000. And I would prefer to say chance or possibility and not risk. And then if the screening test is positive, it means invasive test will be needed. So those who are afraid and want to feel, say they do not want to go ahead with any invasive testing because somebody may have previous abortion and the person may feel very afraid of going for invasive testing, then they should not go ahead with screening testing, or do so after the whole discussion with the doctor. So the invasive testing means taking fluid from the amniotic fluid, which is in the, like this is the fluid filled bag in which the baby or fetus is floating or growing. And the prevention means there is no treatment for intellectual disability. We are not preventing intellectual disability, but we are preventing the birth of a child with intellectual disability. So prevention means termination of pregnancy. So this probably everybody need to know that when you want to prevent Down syndrome by all these screening methods, you should be prepared for termination in case if the child has the Down syndrome. And again to stress, it can test only Down syndrome and some few chromosomal disorders, but not all causes of intellectual disability. Here you can see a happy girl with trisomy 21. She has her karyotype, and this was done when the baby she was in the mother's womb. And at that time, the parents got to know that the child has trisomy 21, but they decided not to terminate the pregnancy, and they are very happy about it. The girl is very pleasant, loving, and she is holding her own karyotype, and the parents came to me to talk about some other medical issues, but they said that they are happy with the decision that in spite of knowing that the child had trisomy 21, they did not terminate the pregnancy and continued it. So summarizing again, the same things which I had told. Uh, so one has to know what Down syndrome is and then decide about which test to undergo for screening, whether they would like to go for screening or not. And then feel free to ask questions to your doctor before making all these decisions. This is not the test which would order. We will say, do it. We would like you to understand and then the implications of the test, the utility and limitations, and then to take your decision about going for such a screening test or not. And if there is families, IVF, maybe if the family has previous child with trisomy 21 or any other genetic disorders, or if there are twins, then the issues are different, and all these issues should be discussed with the doctor. They will have priority over diagnosing or going ahead for screening for trisomy 21. Especially those who have a previous child with trisomy 21, they usually like to go for direct amniocentesis because they would like to ensure that the fetus, the test on the fetus is 100% accurate. So please note that screening for Down syndrome is an option and not compulsory. The information is to provided all families, and it's up to them to decide whether they would like to go ahead for testing or not. And then if you are going to undergo screening tests, follow the proper timeline, because by 20 weeks we should have all the results, and then you should be ready for decision making. No repeat testing, or no two types of screening tests in the one patient. That is not necessary. It cannot. Then doing it later on, we can do amniocentesis at for 24 weeks, but utility is limited because termination of pregnancy is legally not allowed after 24 weeks. As I said, normal ultrasonography does not rule out Down syndrome, And termination of pregnancy is personal decision of the mother and the family, and doctor cannot advise. We can tell you whether the fetus has Down syndrome or not, or any other abnormality, and what would be its implications. But we cannot advise, as a doctor, we cannot advise anybody to terminate the pregnancy. These are some of my friends who were enjoyed with us on a Down syndrome, World Down Syndrome Day, which falls on 21st March, because March is 3 and 21st is the 24 chromosome 21. The young man on the right side with a baby on with blue shirt, he is a special father because he adopted the child with trisomy 21 before his marriage and took care of him by taking 1 year leave. He brought up the baby, got a surgery for heart defect done, and is leading very, very rewarding life. So, other than Down syndrome, please take care of all other medical issues, food in during pregnancy, and lot of anxiety, which sometimes is caused by screening for trisomy 21, is not good for the pregnancy. So that is all which I wanted to convey, and this would help, though it's a longish information, but it would help you in decision making and avoiding the undue anxiety caused by these screening tests. For more information how these Down syndrome children perform, you can see a lot of things, including the Hindi movie Ahan, where that young adult with trisomy 21, how he helps his neighbor and to come out of his psychological issues. And the child which has, whom I told that is adopted by a father, young man, and this child with Down syndrome could trek up to the climbed Everest base camp at the age of, I think, 9 years. And such type of achievers are there. Of course, this is a really achievement of the child as well as the parent. So we bow to them, and I thank you for all your attention. Thank you very much.